Hi everybody, and welcome to part 2 of our series on teaching PACU nurses to be the block nurse for the insertion of a catheter for use with the continuous catheter infusion and the on-cue pump. In part 1, you'll remember that you were taught how to set up our sonogram machine, which the provider will use for guidance of the needle in the procedure. And you also started to gather your supplies for the table. We're going to go ahead and progress through the actual process of inserting the catheter, and we'll just walk through the different actions that the provider takes and how they guide us through as the nurse, helping them with the procedure. So we'll get started. I'll go ahead and put on a pair of gloves now. Dr. Jendal is here with us today, and she will help us with the catheter insertion procedure.
So I'm starting by putting my sterile gloves on first. Here I have the catheter kit provided by Avanos. It has most of the supplies in it. There's a few items the block nurse will have to drop in.
So for instance, we'll put extra tegaderm on, and you just simply open and drop onto the sterile field since I don't have sterile gloves on, and then discard that. There's a few other items we'll put on the field for them, but that's just an example of how you would open onto the field.
So first thing is I am going to prep and drape. The kit comes with a prep stick. So I'm going to be prepping the area after we've done our timeout, of course, and labeled the area that we will be working in. So prep in the area, let it dry for the 3 minutes with the ChloraPrep, and I will drape the area. It does come with sterile drape. Some people feel like it doesn't give enough space, so that's why we would have sterile towels if need be. So I'm just going to open up, drape the area sterilely.
While she's getting ready, I did forget to mention, as I know it's a newer procedure for our PACU team, performing a timeout, there's a policy that walks the nurse through their assistance in it. But basically the key pieces of a timeout are that the provider performing the procedure is at the bedside, a nurse is involved, the patient ideally is involved, and we're verifying this is the right patient for the right procedure and the right location. So that does precede even opening the kit most of the time, making sure we're pausing before we start any procedure, and then that's documented in the EMR as well. All right, so we'll go back to you.
First, we're going to prep our ultrasound.
All right. So I get the ultrasound probe. You want to get the linear probe. For any reason, there are a few procedures that use the curvilinear. The provider will tell you which one to use. So you get the probe, making sure one more time that you've got the correct patient and we're on the nerve setting. And
if you could just put a thin layer of the ultrasound gel before handing it to me, that would be helpful.
So we're going to take the gel that's on the cart, a very thin ribbon across the top, or just as Dr. Jendal asked, don't drop it.
I'm going to be grabbing this from you, and we're going to be pulling this. So you can touch that bottom end of it.
Yeah.
Pull it sterilely. And it comes with a rubber band. So I'm going to secure this. So, and I just leave it on my sterile field so I know it's ready to go. The next thing I do is I prep my area with the catheter kit. I'm going to open my catheter itself. And then I'll have the medication and then the local. The first thing I'll do is inject local into the area. So I use my ultrasound to find the spot we're working in, do a skin wheel, give it a few minutes. Once I feel like the patient's adequately numbed up, taking my Tuhi needle to do my supraclavicular catheter. So I use the ultrasound, find the correct placement, and once I'm in the right spot, I'm going to let go of the ultrasound with one hand, and I can let go of the other hand. The block nurse will have the local anesthetic in a syringe. So I'll let you just hold it. This is just pretending that you had that originally.
Yeah.
And this is how we're going to keep it sterile to inject. So I am going to connect the local syringe to my syringe, and we're going to flush it.
I'm just pressing a little bit to flush through the catheter.
Once it is flushed, I'm going to attach it to my needle here. and we are going to look and see if I'm happy with the placement of the needle. So we're gonna, just like we do for single shot injections, we're gonna aspirate.
So each time that the nurse is communicating with the provider, you say out loud, I'm aspirating. We're checking for no blood return. And then once we're satisfied with no blood return.
So give 1 cc, oftentimes we'll ask for 1 cc just to open up and hydrodissect the space.
So I say I injected 1 cc.
So I'm happy with that. Let's aspirate and give 5 more.
Aspirating, and again, you're just verbalizing the entire time how you're working with the provider. I'm giving 5 given.
Perfect. And then aspirate, give 5 more.
Aspirating, no blood return, giving 5 more. You're noting for the provider as well if you feel a great deal of pressure here, and they'll walk you through next steps. Also, our sonogram turned off, but she is looking the entire time at the sonogram as it will show the placement of the local anesthetic where she wants it in the correct place for the patient.
The other thing is there's not typically much pressure with this because the catheter needle is larger than a single shot injection, so most of the time you're not going to feel added pressure with the catheter.
Okay.
So the next thing I'm going to do is remove this piece. You suck back because there's going to be fluid in here, just you can suck it back. And then sometimes I'll just leave this here, you can disconnect it.
Okay.
That way if we need to get it later on, we can.
Okay, great.
The next thing I'm going to do is advance my catheter. I have my catheter placement here. So I'm going to make sure my guide wire is all the way through. It was a skinny kink. I'm happy with the placement. So what I typically do at this point is leave my catheter there, look at my ultrasound, make sure I'm happy with where the tip of the catheter is located. And if I'm happy, I'm going to slowly advance and take my needle out. And I usually watch to make sure that it hasn't migrated simultaneously. Once I'm had a happy spot, I hold the tip at the skin, pull back, pulling my guide wire out. Next thing I'll do is attach my connector and make sure it's very secure. Alright, so now if I'm happy with the placement, I'm going to ask you to connect one more time here. Same thing, aspirate.
Aspirating, no blood return.
And it's going to be tight in this catheter. It's very thin. You're going to feel quite a bit of resistance in injecting this time around. And inject 5 cc's here.
Okay, 5 given.
While you're injecting that, I'm looking at the ultrasound to make sure I'm happy with the spread of the local anesthetic. Looks like I'm happy, so I think we're good. Thank you. So we'll unscrew this.
And then whenever the provider asks you to, you're going to come over here to the monitor, and there's a little button that's a camera. That button is the picture saving button, and you simply click it anytime the provider asks you to. That saves the image, and then we'll review at the end how to send the image correctly to Epic.
Okay. And then after that, we're going to be sterilely dressing it. So the kit comes with some steri strips. We're going to have Dermabond placing first. The first thing is to put the Dermabond, let it dry. If we try to dress it while the Dermabond is dry, you're not going to get the added benefit of leakage prevention. And after that's dry, I typically, while I'm waiting for it to dry, I surround the area with some benzoin just for added adhesive property. And I tend to coil my catheter and then put some steri strips to secure it in place. After that's finished, I put a Tegaderm on top, and there's an added connector at the end of it that we will attach, and this is the piece that will ultimately be attached to the on-cue ball after the surgery is finished.
All right. So we'll assist in the provider with cleaning up, and the procedure part of this is done. The next videos that you'll be needing to watch are just the after piece of making sure that you start to document that you've hooked up the infusion, charting on your flow sheet in Epic, and making sure that you guys save and send the image over. So let's actually quickly come over here to the sonocyte machine, the sonogram. Want to make sure you guys see Anytime you're asked to save or take an image, you're hitting the camera button. And then at the very end, when the procedure is done, the very first step you want to take, even as we're starting to clean up the patient, is to save and send the image to Epic. And that is just simply done by hitting patient, information, and then you end the exam. That is the most important button you can select. That takes the image and puts it through our imaging system over to Epic so that it can be viewed there. And then after you've hit the end button, you can hit done. At that point, you can take the sonogram away and clean it. You can just use a cavi wipe to do that. And that ends our portion of the catheter insertion step prior to a patient getting an on-cue pump. Thank you so much. Make sure to watch all of the videos in this series. Thank you.